Hello, and a very warm welcome back to our space together. I'm Dr. Rose Khavari. Last week I was speaking with a lovely patient of mine, a woman in her late 60s, who I'll call Carol. Carol is the kind of person who lights up a room. She volunteers at the local library, her garden is the talk of the neighborhood, and she just learned how to video call her grandkids on her new tablet. But as we were finishing her checkup, she hesitated. She looked down at her hands and said in a quiet voice, almost a whisper, "Dr. Rose, my husband John and I have been married for 45 years. He's a good man. I love him dearly. But I find myself making excuses to avoid being intimate. I'll say I have a headache or that I'm just too tired from gardening. The truth is, it's not that I don't want to be close to him. It's that it has become uncomfortable. Sometimes it's even painful. I see the disappointment in his eyes, and the guilt I feel is just enormous. I feel like that part of my life, the part of me that was a wife in that way, is over, and I'm truly mourning it." Her words struck me so deeply because her story is one I've heard in countless variations from so many wonderful women. Just the other day, another patient, let's call her Diane, a retired teacher, confessed her biggest fear was her husband initiating intimacy because she was worried about bladder leakage. She said, "How can you feel sexy when you're worried about an accident?" These stories highlight a quiet shared assumption in our society that, after a certain age, sexual intimacy is something you simply put on a shelf like a cherished book you'll never read again. It's a chapter that's considered finished, and it's often accompanied by a profound sense of lost guilt or even shame. So today I want to have a gentle, honest, and deeply hopeful conversation about this very topic. We are going to talk about how women, especially after 60, can rediscover and enjoy intimacy again, safely, comfortably, and joyfully. This isn't about chasing youth or turning back the clock. It's about learning to embrace the beautiful, wise body you have now, understanding its new language, and finding new and often deeper ways to connect. This is your time, and you deserve to feel whole, connected, and happy in every single aspect of your life. You might be wondering, with everything else going on, why dedicate a whole conversation to this? It's a fair question. In my over 15 years as a urologist specializing in women's functional health, I've seen firsthand that a healthy, fulfilling, intimate life is tied to so much more than just a few moments of physical pleasure. Think of it as a vital nutrient for your relationship. It's a cornerstone of emotional connection with a partner. For many couples who have been together for decades, life can sometimes fall into a comfortable but distant routine. You become wonderful partners in running a household, maybe even professional grandparents, but the romantic connection can fade. You become, as one patient once described it to me, the best of roommates. Intimacy in all its forms is the language that says, we are more than just partners, we are still lovers, I still see you, I still desire you. It's a powerful reaffirmation of a lifelong bond, and the benefits to your personal health are remarkable. We know from solid research that physical intimacy is a powerful stress reducer. In those moments of closeness, your body releases a cascade of beneficial hormones like oxytocin, often called the cuddle hormone or bonding hormone. It promotes feelings of calm contentment and security. That feeling of well-being doesn't just vanish when the moment is over. It can lower your blood pressure, help you handle the stresses of daily life more effectively, and lead to deeper, more restorative sleep. And yes, some studies even show it can give your immune system a helpful boost. But perhaps more than all of that, feeling sensual and desired is a fundamental part of the human experience. It has no expiration date. Our society is often obsessed with youth. It bombards us with images that suggest beauty, vitality, and desire belong only to the 20 and 30-somethings. It can make us feel that as we get older, as our bodies change, we should become invisible, that our desires are no longer relevant or appropriate. I am here today to tell you with all my professional and personal conviction, that is absolutely untrue. Your capacity for pleasure, your desire for closeness, for touch, for connection, it is natural, it is healthy, And it is important. It is part of your vitality. Ignoring this aspect of your health isn't a neutral act. It creates a vacuum. It can lead to profound feelings of isolation even when you're lying next to someone every night. It can create a quiet distance in a relationship that slowly widens over time. And it can take a serious toll on your self-esteem, making you feel that your body has somehow failed you. So, when we address the physical discomforts that are so often the root cause of this avoidance, we're not just fixing a problem. We are reopening a door to connection, to joy, to self-confidence, and to a vital life-affirming part of your overall well-being. To find the right solutions, we first have to gently and honestly understand what's happening in our bodies. Let's talk about it simply and clearly without any complicated medical jargon. The biggest single change agent, as most of us are well aware, is the dramatic decrease in the hormone estrogen that happens after menopause. I want you to think of estrogen as your body's master gardener for the pelvic region. For decades, it kept the tissues watered, plump, and resilient. It was the great moisturizer and elasticity expert. When its levels declined significantly, several predictable things happen. First, and most commonly, is the issue of vaginal dryness, or what we medically call atrophy. It's not a very nice word, but the concept is simple. Imagine a beautiful plush velvet cushion. As estrogen levels fall, it's as if that velvet becomes a bit thinner, drier, and less plush. The walls become less elastic, and the natural moisture that was always there on demand simply isn't produced as readily. This is the number one reason intercourse can become uncomfortable, leading to friction, irritation, and sometimes sharp pain. I need to repeat this. It is not your fault. It is a physiological change, as predictable as getting gray hair, and it is incredibly common and treatable. Second, let's talk about the pelvic floor muscles. Picture a strong, flexible hammock made of muscle stretching from your pubic bone in the front to your tailbone in the back. Over a lifetime, this hammock can lose some of its tone and strength. This can affect you in two ways when it comes to intimacy. A weaker pelvic floor can decrease sensation, but it can also contribute to those confidence-shattering issues like bladder leakage during physical exertion, which can absolutely make you feel self-conscious and anxious during sex. And third, and just as important, are the emotional and psychological changes that create a powerful feedback loop. The first time sex is painful, it's a shock. The second time you approach it with hesitation. Your brain, in an effort to protect you, sends signals to your entire body to tense up. This physical tension then creates more friction and more pain. It becomes a self-fulfilling prophecy. This is the pain-anxiety cycle, and it can turn what was once a source of pleasure into a source of dread. On top of this, there's body image. After 60, 70, or 80 years of life, our bodies are a roadmap of our journey. Learning to love and honor this body instead of comparing it to the body you had at 30 is a profound emotional journey. How we feel about our bodies directly impacts how free we can feel in our bodies during intimate moments. So you see, it's rarely just one thing. It's the physical changes of dryness and muscle tone meeting the emotional state of anxiety and body consciousness. And the truly wonderful news is that we have gentle, effective, and empowering ways to address every single one of these points. Now, before we get to the solutions, it is crucial that we clear the air. Let's bust a few of the most common myths right now. Myth number 1. Pain during sex after 60 is just a normal part of aging, and I have to learn to live with it. This is the single biggest and most harmful misconception I want to shatter today. Let me be as clear as I possibly can be. Pain is a signal, not a sentence. It is your body's way of saying, hey, something needs attention here. It is not your new normal. Discomfort in the bedroom deserves the same level of care and attention as any other pain. It is common, yes, but it is also highly treatable. You do not have to endure it. Period. Myth number 2. My sex drive is gone for good, the fire is out. This is a myth rooted in a misunderstanding of how desire can evolve. As we age, desire often becomes more responsive. Responsive desire is like building a beautiful campfire. It doesn't just appear. You need the right conditions. You need a safe, warm space. You need to gather the kindling that's the emotional intimacy, the shared laughter, the non-sexual touch. Then you need to gently fan the embers. That's the kissing, the massage, the sensual exploration. Your spark isn't gone. You just need to learn how to be a tender campfire builder. Myth number 3. Using lubricants is embarrassing. It's an admission that my body is failing. Oh, I want to free you from this thought forever. This is absolutely not true. I want you to completely reframe how you see lubricants. Think of them as an act of profound kindness and intelligence for your body. Using a lubricant isn't a sign of failure. It's a sign of wisdom. It's a smart, practical wellness tool that instantly makes things more comfortable and pleasurable for both you and your partner. Taking control of your own comfort is a sign of strength and self-care, not a weakness. Okay, so now that we understand the why and have busted the myths, let's get to the how. This is the hopeful part. Here is your practical, empowering toolkit for rediscovering comfortable, joyful intimacy. 1. Communication is your undisputed superpower. Everything starts here. You cannot solve a problem you don't talk about. This conversation needs to happen outside of the bedroom at a neutral time. Use gentle, non-blaming I statements. For example, "Honey, I've been thinking and I miss feeling close to you in that way. Lately, things have been physically uncomfortable for me and it makes me sad. I'd love it if we could work together as a team to figure this out." This opens the door and gets you back on the same team. 2. Become a connoisseur of lubricants and moisturizers. Let's make this simple. There are 2 categories. Vaginal moisturizers. Think of these like your daily face cream. They are for overall tissue health. You use them regularly a few times a week to restore moisture on an ongoing basis. Lubricants. Think of these as your special occasion product used right before and during intimacy to eliminate friction. Here's your mini shopping guide. Go for water-based or silicone-based. Read the label. Avoid glycerin, parabens, and any strong fragrances or gimmicky additives. Simple is better. Application, be generous, it's all about comfort. 3. Explore low-dose vaginal estrogen. For many, many women, this is the true game changer. We are talking about delivering a tiny, biologically identical dose of estrogen directly to the vaginal tissues where it's needed, with almost none of it being absorbed into the rest of your body. It is incredibly safe and effective. The main forms are cream applied with a small applicator, tablet A, tiny tablet you insert. Ring, a soft, flexible ring that works for 3 months. This is a prescription item, so it's a hopeful, positive conversation to have with your doctor. 4. Radically redefine sex. For too long, we've had a very narrow, goal-oriented definition of sex. I invite you to throw that definition out the window. Intimacy is a vast, beautiful landscape. Let's create a new menu of intimacy that takes the pressure off. This menu could include a long shared bath or shower, giving each other a slow, sensual massage, exploring other forms of physical intimacy pleasure that is focused on caring touch kissing, and exploring closeness in ways that don't involve intercourse. Just cuddling. The simple act of holding each other can be profoundly intimate. When you take the pressure off, it frees both of you up to simply enjoy what feels good right now. 5. Nurture your pelvic floor. A healthy pelvic floor improves bladder control and can heighten sensation. Kegels. The key is doing them correctly. Gently squeeze and lift the muscle as if trying to stop the flow of urine. Hold for a count of 3, and then this is the most important part, release it completely for a count of 6. The relaxation is just as important as the contraction. Pelvic floor. Physical therapy. If you have significant pain or leakage, I cannot recommend these specialists enough. They are like personal trainers for your pelvic region and can work miracles. So let's bring all of this together. If there is one word I hope you take away from our chat today, it is the word hope. Your intimate life is not over. It is not a closed chapter. It is simply entering a new season. Remember these key truths. You are not alone. Pain is your body's messenger, not your life sentence. It is treatable. Communication and lubrication are your 2 best friends. Modern medicine offers wonderfully safe and gentle options. And finally, be so very kind to yourself. Your body has carried you through a lifetime. Treat it with the reverence, love, and patience it so richly deserves. This chapter of your life can be one of deep connection, profound warmth, and surprising pleasure. It may look and feel different than it did at 30, but I assure you it can be just as meaningful, and in many ways even more so. Thank you so much for trusting me with your time and attention today. It is a privilege to have these conversations. If you found this helpful, please consider subscribing to the channel for more discussions on living your healthiest, most vibrant life after 60. And please, if you feel comfortable, share your thoughts or questions in the comments below. Your wisdom benefits us all. Until next time, be well, be kind to yourself, and know that you deserve to feel good in every way. Bye for now.